Control of hormone secretion. So 3 mechanisms control the secretion of hormones: feedback control loops, biorhythms, and control by the central nervous system, the CNS. Feedback loops. So feedback loops are a response within a system that regulates further activity of the system and are described as either negative or positive. So I'm going to use this diagram here. So ACTH, secreted by the anterior pituitary gland, stimulates the target organ, the adrenal cortex, to secrete cortisol. As blood levels of cortisol increase, the cortisol in the blood chemically tells the anterior pituitary gland to slow further secretion of ACTH. So as you can see, the anterior pituitary gland, it's going to secrete the ACTH, which activates the adrenal cortex. From there, the adrenal cortex is going to secrete cortisol, and depending on if the levels are too high or too low, it's going to tell the anterior pituitary gland to stop producing the ACTH. Okay. Positive feedback loops cause an enhanced response, a self-amplification cycle in which a change is a stimulus for an even greater change in the same direction. Positive feedback loops are often designed to produce a rapid response. Biorhythms. So blood levels of most hormones are controlled by biorhythms. A biorhythm is a rhythmic alteration in a hormone's rate of secretion. Some hormones, such as cortisol, are secreted in a circadian rhythm, which is a 24-hour rhythm. Cortisol secretion is highest in the morning, it peaks at 8 a.m., and lowest in the evening hours, so lowest at midnight. The female reproductive hormones represent another biorhythm. They are secreted in a monthly pattern, hence the monthly menstrual cycle. Biorhythms can be disturbed by travel and alterations in sleep patterns. Some drugs are administered on a schedule that mimics normal biorhythms. Steroids are given in the morning when natural rhythm levels of steroids are highest. The effect of biorhythm on drugs have a branch of pharmacology that addresses this issue called chronopharmacology. Control by the CNS. So the CNS helps control the secretion of hormones in 2 ways: activation of the hypothalamus and stimulation of the sympathetic nervous system. When we are stressed out, the CNS causes several of the endocrine glands to secrete hormones, thereby altering every cell in the body to the threat. The functions of the nervous system and the endocrine system is called psychoneuroendocrinology. So let's rethink of what we just learned. Explain the difference between negative and positive feedback control. A negative feedback loop rewinds itself to bring us back to homeostasis. A positive feedback continues the change, such as oxytocin during labor. So as the oxytocin is produced in labor, the body's going to tell it to continue to give off that hormone. So that's why it's positive. Number 2, explain why the menstrual cycle is called a biorhythm. Because they are secreted in a monthly pattern. Okay, let's go on to part number 3.